are based on the nature of the diseases. As recorded in the book Ling Shu, the reinforcing method is applied in cases of deficiency, fullness should be relieved, and the excessive pathogenic factors must be dispelled by the reducing method. It also says that heat syndromes should be treated by swift needling, while cold syndromes by retention of needles. If the qi is deficient, moxibustion should be applied. If it is neither deficient nor excessive, merely select points along the affected meridian. The reducing method is to dispel the pathogenic factors and remove stagnation in order to help restore systemic immunity, and is indicated for excessive syndromes, while the reinforcing method is applied to deficiency syndromes to restore the qi in the body. For excessive heat syndromes, the method of brisk needling or spot pricking with a 3-edged needle to cause bleeding is used to reduce and dispel pathogenic heat. Needle retention or moxibustion is applied to patients with deficiency syndromes such as strong pathogenic colds or stagnation of zangfu, meridians, collaterals, and qi to enhance yang and dispel coldness. When qi and blood stagnate and block the jin lao, the bloodletting method is applied to remove the stagnation. Moxibustion is applied to raise yang qi and to lift prolapsed zangfu organs. Points of the affected meridian are chosen to regulate qi in blood for syndromes which only involve particular meridians. For example, Waiguan Sanjiao 5 can be chosen for migraines. Clinical application of acupuncture must be based on the theory of traditional Chinese medicine with reference to the traditional diagnostic methods to set up the 8 principles of yin and yang, cold and hot, exterior and interior, and deficiencies and excesses. Only then can the principle of treatment be determined. There are 3 categories of point selection. 1. Selection of local points. This means choosing points which are near the diseased area. For example, Zhongwan, Ren 12, and Liangmen, Stomach 21, can be chosen for epigastric pain. 2. Selection of distal points. This refers to the selection of points far from the diseased area. For example, choosing Zusanli, Stomach 36, for epigastric pain. 3. Selection of symptomatic points. This refers to the selection of corresponding points according to some prominent symptoms. For example, Danzong, Ren 17, is selected to treat qi disorders. There are 5 categories of clinical combination of points. 1. Selection of points from the diseased meridian. That is to say, points along the diseased meridian to which one of the organs is related will be prescribed. For example, Zhongfu, Lung 1, Chizi, Lung 5, and Yuji, Lung 10 are selected for cough. 2. Selection of externally and internally related points. That is, if a disease occurs in a certain zangfu or meridian, points which are externally and internally related are prescribed. For example, Zusanli, Stomach 36, and Gongsun, Spleen 4 are selected for epigastric pain. 3. Selection of anteriorly and posteriorly related points. It is also called combining abdomen and back points or yin and yang point selection. For example, Jianshu, bladder 14, and Danzhong, Ren 17 can be chosen to treat heart pain. 4. Selection of superior and inferior points of the body. For example, to treat migraine, Fangchi, gallbladder 20, and Xiaxi, gallbladder 43, can be selected. 5. Selection of left and right points. This method is applied to selection of points on both sides or the opposite side to the diseased area. For example, Jianyu, large intestine 5, Quqi, large intestine 11, Hegu, large intestine 4, on both sides are selected to treat forearm pain, while Meiguan, pericardium 6, and Yangmingquan, gallbladder 34 of the left side are chosen to treat hemiplegia of the left side. The 5 shu points are a simplified name for the 5 points of the 12 meridians located below the elbow and knee, namely Jing, well, Ying, spring, Shu, stream, Jing, river, and He, sea. The ancient Chinese doctors compared the flow of qi to that of a river, small and shallow at the beginning, becoming larger and deeper gradually. The points at which qi springs up are called well points. The points where qi flows copiously are called spring points. Points where qi flows like a stream are called stream points. Points where qi flows through are called river points. And where qi gathers are called sea points. The theory of the 5 shu points is derived from clinical practice, and it can be explained by the theory of root and branch. Clinical application of the 5 shu points should be in accordance with the characteristics of climate and seasons. In spring and summer, shallow acupuncture on Jing-Ying points is applied, while in autumn and winter, deep acupuncture on Jing-He points is preferred. The 5 shu points can also be used according to the indications pertaining to each of them. For example, Jing well points are indicated in the fullness of the stomach, Ying spring points in febrile diseases, Shu stream points in listlessness and painful joints, Jing river points in asthma, cough, and fever, and He sea points in diarrhea and preservation of qi. In addition, the 5 shu points can be selected according to the respective relationships with Zangfu and the 5 elements. That is, the method of reinforcing the mother and reducing the son. For example, the excess lung syndrome can be treated by reducing the Qizhe lung 5 point, which pertains to water in the lung meridian. This is called reducing the sun in excess syndrome. In contrast, the deficient lung syndrome can be treated by reinforcing the Taiyuan lung 9 point, which pertains to earth in the lung meridian. This is called reinforcing the mother in deficiency syndrome. Apart from these, reinforcing and reducing can be applied not only between mother and son points, but also between mother and son meridians. Each Zangfu has its corresponding shu point and mu point. Mu points are located in the chest and abdominal region, while shu points are on the back. The shu and mu points, when used in combination, can treat corresponding Zangfu disorders. For example, the front mu point Zhongwan, Ren 12, and the back shu point Wei Shu, bladder 21. the Mu and Shu points of the stomach may be selected for stomachache. The Yuan source points treat Zangfu diseases, while the Luo connecting points treat disorders of externally and internally related meridians. The Yuan and Luo points may be used independently or in combination. The first affected meridian is compared to a hose, the second a guest. For example, if the lung meridian is first affected, the Yuan point Taiyuan, lung 9, is selected. If the large intestine meridian is affected second, the Luo point Pianli, large intestine 6, is selected. The 8 confluent points are those in the extremities connecting the 8 extra meridians. For example, Gongsun, spleen 4, connects with the Chong meridian, and Neiguan, pericardium 6, links with the Yin-Wei meridian. These 2 points, when used together, can treat disorders of the stomach, heart, and chest. The 8 influential points may be used to treat the diseases of the corresponding tissues and organs. For example, Danzhong, Ren 17, the influential point of Qi, is applied to the internal heat syndrome, while Zhongwan, Ren 12, the influential point of Fu, is used to treat Fu organs. C cleft points are selected for acute diseases of the affected meridians and Zangfu organs. For example, the C point Kongzui, lung 6, is selected and treated for lung diseases accompanied with hemoptysis. The C point Ximen, pericardium 4, may be treated for heart pain. The lower He-C points refer to the 6 He points located below the 6 Fu organs of the 3 young meridians of the foot. They can be selected and treated for corresponding Fu diseases. For example, Shangzhu Xu, stomach 37, is for large intestine disorders, and Xiaju Xu, stomach 39, for small intestine disorders. The crossing points refer to those located at the intersection of 2 or more meridians. They can be used to treat disorders of the related meridians and Zangfu organs. For example, San Yin Jiao, spleen 6, is used for treating diseases of the liver, spleen, and kidney, and the respective meridians. Stroke, diagnosis and treatment. Stroke is an emergency case manifested by sudden collapse with loss of consciousness or even coma, often resulting in hemiplegia and aphasia. It is caused mainly by disorders of the heart, liver, spleen, kidney, and also by an invasion of wind, fire, and phlegm. When wind and phlegm attack the meridians, they block the flow of qi and blood, or disturb the mind, and thus result in this disease. Stroke refers to cerebrovascular diseases, such as cerebral hemorrhage, cerebral thrombosis, cerebral embolism in modern medicine. Stroke is divided into 2 categories. One involves the Zangfu organs, while the other involves only the meridians. The former may manifest itself as coma, etc. In the latter, the patient may be conscious, but suffers from hemiplegia, deviated mouth, dryness of the throat, and slurring of speech. To treat hemiplegia, the points of the affected side, Jianyu, large intestine 15, Qu-Qu, large intestine 11, Waiguan, Sanjiao 5, Hegu, large intestine 4, Huangtiao, gallbladder 30, Yuanlingquan, gallbladder 34, Fanglong, stomach 40, and Xuanzhong, gallbladder 39, may be selected and needled with an even movement method to regulate qi and blood in the meridians. After routine sterilization, puncture Jianyu, large intestine 15. Chuchu, large intestine 11. Waiguan, Sanjiao 5. And Hegu, large intestine 4. These points can regulate qi, blood, and the meridians. Needle the Huantiao, gallbladder 30 point, until the sensation reaches the foot. And now puncture Yangling Quan, gallbladder 34. Now puncture Fanglong, stomach 40. And finally puncture Xuanzhong, gallbladder 39. All these points have the function of removing obstructions from the meridians and promoting the smooth circulation of blood. To strengthen the effect, the electric needle is applied with a continuous wave at low frequency for 30 minutes. Scalp acupuncture may also be applied. Puncture subcutaneously along the anterior oblique line of vertes temporal on the side opposite to the affected one. The electric needle is applied once a day with continuous wave at high frequency for 30 to 60 minutes. The patient is encouraged to exercise his affected limbs. For slurring of speech or aphasia, the points Yamen, Du 15, Lianquan, Ren 23, Tongli, Heart 5, and Fanglong, Stomach 40, can be needled with an even movement method to remove the obstruction and promote the circulation in the meridians. After routine sterilization, puncture Yamen, Du 15. Do not puncture too deeply. This will help restore the function of speech. Puncture Lianquan, Ren 23, to restore the function of the tongue. puncture Tongli, heart 5, to regulate the meridian. And puncture Fenlong, stomach 40, to dispel phlegm. The treatment is given once a day or once every other day. One course consists of 12 sessions. For patients with difficulty in swallowing, the points Lianquan, Ren 23, Tiantu, Ren 22, Danzhong, Ren 17, Neiguan, pericardium 6, and Jiaohai, kidney 6, can be selected and needled with an even movement method to regulate qi in the meridians and restore the swallowing function. After routine sterilization, Lianquan, Ren 23, is punctured to regulate the flow of qi and restore the function of speech. Puncture Tiantu, Ren 22, to regulate qi and restore the function of the tongue. Danzhong, Ren 17 point is punctured to regulate the flow of qi and to suppress the pathogenic factors. The Neiguan, pericardium 6 point is punctured to relieve the chest. The Jiaohai, kidney 6 point is punctured to nourish the kidney yin. The treatment should be given once a day or once every other day. One course consists of 12 sessions. Diseases of the Zangfu organs can lead to loss of consciousness. If it's an excess syndrome, Shui Guo, Du 26, the 12 Jingwell points, Tai Chong, liver 3, and Fenlong, stomach 40, are all needled with a twirling and reducing method to expel wind, eliminate phlegm, and promote resuscitation. Puncture Shui Guo, Du 26, to revive the patient. Puncture the 12 Jingwell points to remove any obstruction. Puncture Fenlong, stomach 40, to resolve phlegm. And Tai Chong, liver 3, to pacify the liver and expel the wind. In case of deficiency syndrome, indirect moxibustion with salt is applied on Shen Xue, Ren 8, with a large moxicon. Indirect moxibustion with ginger is applied on Guanyuan, Ren 4, with a big moxicon to restore yang from the collapse. Dizziness. Dizziness is mostly seen in hypertension, arteriosclerosis, anemia, and auditory vertigo. Deficiency of qi in blood is generally caused by overthinking and overworking, which leads to damage to the spleen and deficiency of qi in blood. Thus, the brain is poorly nourished and dizziness occurs. Dizziness is accompanied by pallidness and a lusterless complexion, palpitation, weakness, and insomnia. The diagnosis is pallidness of the tongue, with a thin white coating and a thready weak pulse. The points Bai Hui, Du 20, Qi Hai, Ren 6, Zu San Li, Stomach 36, Sanin Jiao, Spleen 6, and Pin Shu, Bladder 20, are needled with a twirling and reducing method in combination with mild moxibustion to nourish the spleen and stomach and to replenish qi in blood. After routine sterilization, puncture Bai Hui, Du 20, to make qi ascend. Puncture Qi Hai, Ren 6, to strengthen the primary qi. Puncture Zu San Li, Stomach 6, with the reinforcing method. Sanin Jiao, Spleen 6, with the reinforcing method to invigorate the spleen and stomach to produce qi in blood. Apply mild moxibustion on points Qi Hai, Ren 6, and Zu San Li, Stomach 36, to strengthen the effect. Puncture Pi Shu, Bladder 20, to nourish the spleen, qi, and blood. Hyperactivity of the liver yang is generally caused by overthinking, anxiety, depression, or anger. The main manifestations are dizziness with a distending sensation in the head, a flushed face, red eyes, and irritability. The tongue is yellow-coated, is string-taut, and there is a rapid pulse. For treatment, the points Fangshi, Gallbladder 20, Ganshu, Bladder 18, Shenshu, Bladder 23, Taixi, Kidney 3, and Xingjian, Liver 2 are needled to nourish yin and pacify yang. After routine sterilization, puncture Fangshi, Gallbladder 20, with the twirling and reducing method to reduce yang. Puncture Ganshu, Bladder 18, with a twirling and reinforcing method. Puncture Shenshu, Bladder 23, with a twirling and reinforcing method to nourish liver yin and kidney yin. Taixi, kidney 3, with the twinning and reinforcing method to nourish kidney yin. And puncture Xingjian, liver 2, with the twirling and reducing method to pacify the liver yang. Interior retention of phlegm dampness results from abundant phlegm dampness or irregular food intake. Clinical manifestations are dizziness, suffocation, sensation in the chest, and nausea. The diagnosis is pale tongue proper, with white and sticky coating and a soft and rolling pulse. For treatment, points Towei, stomach 8, Neiguan, pericardium 6, Zhongwan, ran 12, Fanglong, stomach 40, and Pishu, bladder 20, are needled with the even movement method to relax the chest, resolve phlegm, and eliminate dampness. After routine sterilization, puncture the Towei, stomach 8 point to treat dizziness. Puncture Neiguan, pericardium 6, to relax the chest, harmonize the stomach, and check vomiting. Zhongwan, ran 12 is needled to strengthen the spleen and stomach for eliminating dampness. Puncture Fanglong, stomach 40, with an even movement method to resolve the phlegm. And finally, Pishu, bladder 20, with an even movement method to nourish the spleen and eliminate dampness. The treatment should be given once daily or once every other day, and one course consists of 12 sessions. Headache. When headache is a predominant symptom, it's usually a result of the invasion of pathogenic wind into the meridians, hyperactivity of the liver yang, deficiency of both qi and blood, or stagnation of blood due to trauma. The ailments such as hypertension, migraine, and nervous headache in modern medicine may be included. Headache caused by invasions of pathogenic winds into the meridians may occur suddenly. It is a violent stabbing pain. According to the location, it may be categorized into 4 types. Frontal headache, temporal headache, occipital headache, and parietal headache. Frontal headache pertains to headaches of the Yangming meridians. For treatment, the points Towei, stomach 8, Shangxing, Du 23, Yintang, extra point, Hegu, large intestine 4, and Niting, stomach 44, are selected and treated with the reducing method to regulate the meridians. After routine sterilization, puncture local points Towei, stomach 8, Shangxing, Du 23, and Yintang extra point. Distal points Hegu, large intestine 4, and Niting, stomach 44, are punctured to regulate the meridians and relieve the pain. Temporal headache pertains to the Shaoyang meridian headache. For treatment, points Fengshi, gallbladder 20, Shuaigu, gallbladder 8, Taiyang, extra point, Waiguan, Sanjiao 5, and Xiaxi, gallbladder 43, are all needled with the twirling and reducing method to remove obstructions in the Shaoyang meridians. After routine sterilization, puncture the local points Fengshi, gallbladder 20, Shuaigu, gallbladder 8, and Taiyang extra point to dispel the wind and regulate the meridian. Distal points Waiguan, Sanjiao 5, and Xiaxi, gallbladder 43, are punctured to regulate the qi in the Shaoyang meridians. Occipital headache pertains to the Taiyang extra point meridian. For treatment, points Hoding, Du 19, Tianzhu, bladder 10, and Kunlun, bladder 60, are needled with the twirling and reducing method to regulate qi in the Taiyang extra point meridians. After routine sterilization, local points Hoding, Du 19, and Tianzhu, bladder 10, are needled to regulate the qi in the occipital region. Distal point Kunlun, bladder 60, is needled to regulate qi in the Taiyang extra point meridians. Parietal headache pertains to Jueyin meridian headaches. For treatment, points Baihui, Du 20, Tongtian, bladder 7, Taichung, liver 3, and Zhiyin, bladder 67, are needled with the twirling and reducing methods to regulate qi in the Jueyin meridians. After routine sterilization, local points Baihui, Du 20, and Tongtian, bladder 7, are needled with the reducing method to regulate qi in the top area of the head. To regulate qi in the Jueyin meridians, needle distal points Taichung, liver 3, and Zhiyin, bladder 67. Headache due to hyperactivity of the liver yang is characterized by severe pains on both sides and the top of the head, blurred vision, irritability, and a hot temper. The red tongue proper is yellow-coated, is string-taut, and there is a rapid pulse. For treatment, points Bai Hui, do 20, Xuan Lu, gallbladder 5, Fang Chi, gallbladder 20, Xia Xi, gallbladder 43, and Xing Jian, liver 2, are all needled with a twirling and reducing method to pacify the liver young. After routine sterilization, puncture local points Bai Hui, do 20, Xuan Lu, gallbladder 5, and Fang Chi, gallbladder 20, to pacify the liver young. Puncture distal points Xia Xi, gallbladder 43, and Xing Jian to dispel qi in the liver and the gallbladder. Headache due to deficiency of both qi and blood tends to linger and is accompanied by dizziness, blurred vision, lassitude, a lusterless face, and is aggravated by overstrain. The patient has a pale tongue with a thin and white coating, and there is a weak and thready pulse. For treatment, points Bai Hui, do 20, Qi Hai, Ren 6, Zhu San Li, stomach 36, Gan Shu, bladder 18, Pi Shu, bladder 20, and Shen Shu, bladder 23, are needled with a twirling and reinforcing method accompanied by mild moxibustion to regulate and nourish qi in blood. After routine sterilization, puncture Bai Hui, do 20, to raise the clear young. Puncture Qi Hai, Ren 6, and apply moxibustion to nourish the primary qi. Puncture Zhu San Li, stomach 36, and apply moxibustion to nourish the spleen and stomach and the qi in blood. Puncture the points Gan Shu, bladder 18, Pi Shu, bladder 20, and Shen Shu, bladder 23. Apply moxibustion to strengthen the liver, spleen, and kidney. The treatment should be given once daily or once every other day. One course consists of 12 sessions. Facial pain. Facial pain is a kind of severe pain occurring in transient paroxysms in certain facial regions. It is mostly due to an invasion of pathogenic winds or cold, or excessive fire in the liver and stomach, or a deficiency of yin and excess of fire. It is referred to as trigeminal neuralgia in modern medicine. Upper jaw pain is most commonly seen clinically. It is a severe and paroxysmal pain, on the maxillary region, which is due to pain of the second branch of the trigeminal nerve. For treatment, the points 四百, stomach 2, 全疗, small intestine 18, 巨疗, stomach 3, 合谷, large intestine 4, and 内庭, stomach 44, on the affected side, are needled with a twirling and reducing method to dispel the wind and cold, and to remove obstructions in the Yangming meridian. After routine sterilization, puncture the points 400, stomach 2, 巨疗, stomach 3, and 全疗, small intestine 18, to dispel wind and bring down the fire. Puncture 合谷, large intestine 4, a distal point, to remove the obstructions in the Yangming meridian. Puncture 内庭, stomach 44, a distal point, to reduce the excessive fire. To strengthen the effect, electric needling is applied to 全疗, small intestine 18, and 合谷, large intestine 4, with continuous waves and rapid frequency for 30 to 60 minutes. Supraorbital pain is a severe and paroxysmal pain of the first branch of the trigeminal nerve. For treatment, points 传主, bladder 2, 阳白, gallbladder 14, 鱼咬, extra point, 合谷, large intestine 4, and 内庭, stomach 44, of the affected side, are needled with a twirling and reducing method to dispel wind and heat. After routine sterilization, puncture 传主, bladder 2, Yangbai, gallbladder 14, extra point, to remove obstructions on the forehead area. Puncture 合谷, large intestine 4, and 内庭, stomach 44, in the same way as was done with upper jaw pain. With 传主, bladder 2, and 合谷, large intestine 4, electric needling is applied with continuous wave and rapid frequency for 30 to 60 minutes to enhance the effect. Lower jaw pain is a severe and paroxysmal pain of the mandibular nerve, the third branch of the trigeminal nerve. For treatment, points 下关, stomach 7, 甲车, stomach 6, 加长江, extra point, 合谷, large intestine 4, and 内庭, stomach 44, on the affected side, are needled with a twirling and reducing method to dispel wind and heat and to regulate the meridian. After routine sterilization, puncture 下关, stomach 7, Jia che, stomach 6. And Jia Cheng Jiang, extra point, to dispel the wind, heat, and regulate the meridians. Puncture Hegu, large intestine 4, and Niting, stomach 44, in the same way as was done with upper jaw pain. To strengthen the effect, an electric needle is applied to the Xiaguan, stomach 7, and Hegu,